Hafaday, welcome back, everyone. I apologize for that interruption. We were having technical difficulties with the legislature's YouTube feed. So we are back, and we were, while this hearing has been fully recorded, we were cut off in the middle of Senator Sabina Perez's remarks. Senator Perez, would you like to repeat any of those remarks? They've been recorded, but if you would like to restate them, you are welcome.
Yeah, I'm not sure exactly where I was cut off, but yeah, just basically I wanted to put a plug for my Bill 386 that would help address some of the underlying concerns that Bill 382 also addresses in regards to ensuring that there's a decision is based on science, and that decision is also communicated well to the public. So that was the gist of my remarks, but I want to thank the sponsor for bringing this forward, and thank you to all those that have come to testify. Tzitzis Masi, Madam Chair.
Senator Marshtai to know as well, your remarks were not broadcast. If you would like to just repeat them briefly here, the full remarks have been recorded. All right.
Tzitzis Masi, Madam Chair. You know, I was just discussing how important it is to have these discussions. We know that the community has expressed a lot of concerns, and we can operate, you know, individually, office by office, but it's important that we do have these moments to get together to hear concerns from various aspects of the community, and to be able to just have that open dialogue amongst each other and amongst, you know, the concerns of the community. Being able to hear that all is going to help us understand as much as possible in a way to move forward. But yeah, and I just mentioned that I'm going to continue to do research on this because there are many issues that are involved here, and each one deserves a thorough examination. So, Tzitzis Masi, Madam Chair.
Tzitzis Masi, Senator. Senator Terlaje.
Tzitzis Masi, Madam Chair, and thank you to everyone who's here today. Like Senator Muñoz, I'm also starstruck for having everybody here today, from the Archbishop to our congressman to former congressman. This is an amazing, you know, opportunity, and thank you so much for taking the time out to be here. You know, Madam Chair, I think that moment of recess gave me an opportunity to go get some water because I was out right when you were probably asking me some questions. So I think, you know, something above here is taking care of me, but I really appreciate public health being here. I was hoping to get more information from public health with regards to this legislation. I heard a little bit, Terry, my internet too is breaking up a bit, so I didn't have a chance to hear whether public health came here today to give testimony in support or not support of this legislation. So either Terry or the director, could I hear your stance on this legislation?
And I'll refer the answer over to Art.
Good afternoon, Madam Chair, members of the 35th Guam Legislature, and also Congressman Nicholas and former Congressman Underwood and Madam Chair. So with regards to the measure before us, we on the department side have always had the sense that we want to do a more balanced approach in terms of the quality of life on Guam. So the measure, if it will ensure that and promote a balanced approach while maintaining the public health perspective, the public health mandate, we would support a measure that does that. It has never been the intent for us to deprive our fellow community residents of a quality of life. The measures we took, the mitigating measures that have been implemented and continue to be implemented, is really intended to protect all of Guam, our public health, our brothers and sisters. It was never and is not intended in any way to short the opportunities of our family, our friends to seek and have a rich life in faith, community. Unfortunately, with the virus and how it has evolved here on Guam, we had to put mitigating measures. But the bill in itself, in terms of a local approach, or perhaps a reminder of some of the things that we as a public health department would always want to keep in mind we can support a measure that would help provide us a further framework, in addition, of course, to the Bill of Rights. But with this measure, the Pandemic Bill of Rights, is something that we can always keep in mind in terms of as we move forward with guidelines from the department's perspective. I know throughout the months, there has been changes to the guidelines. As the church has said, we have met with them. We heard their requests. We have also responded favorably to some of their requests and have been looking at how we can provide spiritual richness, encourage other activities while still maintaining social distancing and all the other mitigating measures that the deputy has already touched on, but doing it in a way that we right now as a community through this conversation is perhaps one of many conversations to be had in terms of what is the new norm for Guam. How are we going to coexist and live a life with greater quality, yet while maintaining public health measures that safeguard each of us, those we love, those we come home to, and those we work with. So Senator Tello, any measure that would assist us in the framework, Madam Chair as well, and Senator Munya, your legislation, anything that is improve our measures, help us put thoughts and considerations into how we can put our public health guidance out is welcome. We've not ever shut our doors. We are working with the business community. Paul and Mike earlier talked about contact tracers in the community in the Catholic faith. I thank you for doing that. We are already working with our business community in looking at building their capacity for contact tracers as a concept in their HR areas so that we can also look at the reopening in a balanced approach. We are working with the University of Guam in partnership with the University of California's UCSF San Francisco for contact tracers up there. So we're looking at a multitude of approaches that can help us so that we can control and contain the situation, but always keeping in mind that some of you have said this already, really eventually we're going to look at opening Guam and how will we do that in a balanced public health perspective while maintaining quality of life and protecting our fellow Guam residents. And so we would definitely support legislation that would help frame that and build some parameters for us to work with. And in some situations, I'm sure many will be pleased. In some situations, we may have individuals that are never going to be pleased with the direction public health puts forth, or perhaps even the legislative system or the executive orders. So we're here. We are open to discussions. We're open to anyone listening that if you have a proposed plan or suggestion, please send them to the department. We'd be happy to meet with you, talk with you, and see perhaps your approach, your idea. Maybe none of us yet have thought of that here in this discussion, and we can bring it forth. So and that's where we are with Public Health, Senator.
Well, that was definitely lengthy in explanation, and I had a lot of great ideas in there when you're making recommendations. However, I guess the question I asked, the way it's written right now, then it sounds to me like there needs to be some changes into this legislation that you're still working. So that being said, Madam Chair, I thank you for the opportunity to ask that question again, and appreciate the comments that were made earlier from everyone. Definitely noted. It sounds to me like this may go further into maybe a roundtable discussion for something as important as this, to go further into this. I think that's what's needed right now. I mean, if Deep Public Health is asking for the community to come forward and bring their ideas and everything like that, then I think that's a great idea. And maybe this legislation as the Bill of Rights for the pandemic is a great opportunity. But I have to commend the author for this legislation to do something. She's trying to do something right now to address some of the concerns. And I think it opens the door for everybody's input now into creating something that would be safe for our community, most especially to keep our community safe and to keep our families safe too as well. Well, thank you, Madam Chair. Thank you.
Thank you very much, Minority Leader. Senator Mary Camacho Torres. All right, we will move to Senator James Moylan.
All right, thank you, Madam Chair, and thank you, Archbishop, for your testimony and Congressman Mike and former Congressman Underwood. Also testimony from our Mr. LaGuardia and Mr. Leon Gurrow, and especially to our public health. Thank you very much. So after reviewing the bill, of course, we're referring to Chapter 19 of Title 10, and we know this public law is like over 20 years old, but it's the first time we had to execute the usage of this law. And I think the public law was put together for the right purpose, to expedite the care of our citizens, right? And how this public law is enforced or executed is by the governor through executive order. And one of the things, of course, Archbishop, that you mentioned is how it affected our freedom of religion or at our different houses of worship for Guam, which is very important to us. And I as well, just like you, Archbishop, I did write to the governor expressing my concerns of why haven't we opened up our churches? You know, the first time, I understand, we were all new to our first PCOR 1 situation, but thereafter we went to PCOR 3 and we followed the rules, and things were, for me, working out, and we did the guidelines. But then when we went back to PCOR 1, we could have continued. But I'm glad and I'm happy that the governor has adjusted her executive order to allow us to open. But that's also after we opened the parks, and after we opened the tattoo parlors, and after we opened the shopping malls too. So I think this Bill 382 came about because of the public concerns. And I thank the senator for the authoring of this. And because of the public concerns of communication of the executive orders that we were hoping to be more a part of, as Father Mike explained, and how we needed to be part of this so our government can understand our needs of the people. There's other concerns of how Chapter 19 and Title 10 also work out because of how it's being executed, especially in transparency. And I also authored Bill 338 because currently this public law has no reporting requirements. And that's also another concern of the public too. But this bill specifically, 386, talks about 6 points. That's the freedom of religion and constitutional rights to that, also bearing arms and a due process and seizure of property and criminal acts and fines that Mr. LaGuardia wanted some additional information about. But all goes back to how this public law is executed through the executive orders. You know, and I'm also looking forward to hearing Senator Will Castro's a bill on 3992 on how we can further clarify what we can or cannot do on Chapter 19 of Title 10. You know, usually when we make amendments to bill, it's for, when we make amendments to a public law, it's for something that has been in the books for a while, which this has, but it's never been executed. So this law could be a really good law. The public law is Chapter 19, Title 10, but it's a matter of who has the authority and how it's executed. And I don't think the public is too happy on how that's working out now. I know we're learning our lessons as we go along, but it can be improved, and to include Senator Paris mentioning Bill 386 on how that can improve as well. So I'm looking forward to this bill moving further and getting the committee report and hopefully get onto session floor so we can take a vote on it. But I thank all for those who participated in the testimonies today. Thank you, Madam Chairman.
Thank you, Senator Moylan. Senator Camacho Torres.
Thank you, Madam Speaker. I'm just listening intently to this subject matter. I think there's a lot more to this than what the bill proposes. I have to admit I have some reservations about it. I think that, you know, the rights that it seeks to protect are fundamentally protected already. And there have been a lot of court challenges and rulings on this very subject that, you know, I plan to read up further. But you know, I don't think that many of the rights that we're reassessing or reaffirming here are implicitly denied at present. And so, those are the things that I just want to look at. But I'll reserve any further comment on the bill until, such time that it actually comes before the body for deliberation. But, I just feel that that the rights that we are seeking here are fundamentally protected, I believe. And I don't know that this bill will necessarily help, in advancing those rights or protecting them any further, especially in a pandemic. And I think that we are in a pandemic situation, and that in itself presents a whole different set of circumstances for consideration. But thank you, everyone, for your testimony, though. It's very interesting just to listen to the dialogue.
Thank you very much, Senator Mary. I have a couple questions for the panel as well, but before the questions, I'd just like to state for the record that we did receive a fiscal note from BBMR, which states that the proposed legislation includes 6 different restrictions, most of which are administrative in nature. However, 2 of the restrictions do have correlations to the finances of the government of Guam. 19406D of the Pandemic Bill of Rights states that the government of Guam shall not permit the confiscation or seizure of any lawfully owned property without just compensation. Absent a particular definition for what constitutes just compensation, the Bureau cannot determine the financial impact to the government of Guam. Should it need to utilize private property during a state of public health emergency, 19406F states that the government shall not impose excessive fines. Absent a particular definition for what constitutes as excessive, the Bureau cannot determine an approximate financial impact at this time. That's from BBMR. We have, of course, requested legal review. There are many legal issues that have been brought up at today's hearing. Legal review by our Legislative Council is still pending, but the bill will we will require that before we move this bill any further. And we've also, of course, invited the Attorney General to be present here at today's hearing to help us to assess this bill. We also invited the Guam Bar Association, the Guam Chamber of Commerce, the Guam Women's Chamber of Commerce. And of course, public notices were sent out to all the public. So I did also have some concerns, but in general, because we have this panel here today, I'm very honored, first of all, and thank you again for your patience in being with us throughout. But, I agree. So we're all trying to balance, rights that we are guaranteed by our Constitution, rights that, we have put into law, but also, the safety and the lives of the people of Guam. And I guess I would just ask, while we have you here, if you are willing to help us, the government of Guam, as Congressman Nicholas stated, across the nation, they are having challenges as to the buy-in of the people, the belief of whether the virus is really real, or whether it is deadly, or whether we really need to act in such a restrictive manner, or whether this is a compelling interest. And because that's critical, I'm going to ask if any of you would like to help the government of Guam with suggestions as to how can we get additional buy-in. We also have buy-in challenges, I believe. I think it's indicated by the app. One of my colleagues showed earlier. The buy-in on the tracing app was not what we had hoped for by any means. And so, while public health continues to have its challenges, we have our challenges in general. So would anyone like to comment on that? How, I don't know, Archbishop, especially with the church and you being the leader there, if we allow more activity, how do we get, also additional buy-in that this is very serious and that this is, a matter of life and death in some situations or for some groups of people?
Are you asking me a question?
If you would like to, I'm. Anyone, I'd like to ask you or give you the honor if you'd like to, or just the respect of answering it first, if you'd like to.
Yeah. Well, we have a big reach, as the Catholic Church. We And it's not just the public, because we know all the faces. And so just our efforts in for just how much effort we put into having our churches appropriately distanced and sanitized and all those things. We're not doing that just because we're, OCD. We're doing it because we think it's real. And that's one way that we're communicating to our people, through the people in the Catholic Church, that, yeah, this is really real. And I think that's one of the ways that we get buy-in. So.
Can I ask you, Archbishop, are the churches all following the same protocols, or do they have discretion to do different types of safety protocols?
Yeah, so we do have a set of standard things that we want to do, but at the same time, we practice subsidiarity. Every pastor is going to put his own kind of twist on the thing. Not a twist, but he's going to own it. And so yeah, we're not just giving a cookie cutter kind of thing. We actually ask our priests to be prudent. Like for sometimes some of the priests, the priest is going to say, sorry, we don't have the manpower to pull off a mass this week. And so we're going to do something different.
All right, thank you, appreciate that. Congressman St. Nicholas, would you yield to the question?
Sure, Madam Chair. I think that, well, first of all, I wanted to absolutely tip my hat to public health. Their task and trying to navigate the way forward in something that really no one has ever experienced before is not only an incredibly daunting task, but there really is no way that we can say that what we've decided or what we've done has been based on knowing it was the best course to take. And that being said, I believe that everything that has happened thus far has been with the best intentions. And I think that the best intentions are something that we need to make sure is well communicated to our people. I think that's the first step to reassuring the public that everything that's been done and everything that's being considered and everything that will be done is being done with the best of intentions. That being said, there are certain things that we can definitely determine after going through this for a number of months. The first is that the hot and cold approach of locking everything down and opening everything back up again is definitely creating pent-up demand that we see explode as soon as restrictions are lifted. And those explosions create exacerbated contact risks that probably would not have been so pronounced if there was a more steady flow of traffic, if there wasn't the feeling that we need to rush down and get this or get that because it's going to run out. I kind of compare it to the time when we lost all of our gasoline after I believe it was Pangsongwa. And now every time there's a typhoon, everyone rushes to the gas stations. When we begin conditioning the public to react in ways where they feel like they need to put their health at risk in order to secure commodities that may not be available or may run out or may only be available for a limited time before everything closes down again, we create those artificial demand circumstances that could actually be exacerbating the problem with an on-again, off-again approach. That being said, I would first advise that we try and consider how we can create a sustainable type of regime where there is a standard. That standard is expected. That standard is uniformly enforced, and it isn't an all or nothing approach that's more reacting to data rather than trying to steady the data. Another avenue that I think we could consider is right now we take the approach where we lock everything down. We try and prevent everybody from getting the from contracting the disease. And of course, that's definitely a necessity. However, there may be some merit to directing our resources to definitely promoting the safety of those who are at risk. Perhaps more protocols specifically for those who identify with certain health concerns. For example, coming up with a list of those who have proven to be more susceptible to the disease, advising those with that susceptibility to take greater isolation precautions, advising their households that if you have anybody in your home with this list of pre-existing conditions, be advised that they are at even greater risk of COVID-19. I think that those kind of awareness programs to our community could greatly help families understand that, it's of course, when you're dealing with someone, who's up there in age, that's pretty obvious, but sometimes families don't necessarily disclose for whatever reason to each other that, hey, I'm diabetic, and so this is a time for us to really inform the families that, we don't, whatever you want to disclose to your family members is up to you, but this is a list of pre-existing conditions where if you have these, you are at greater risk for a unfavorable outcome from COVID-19. And communicating that to our community and to our families could really make everybody reconsider whether or not they're going out and exposing themselves. One of the problems is that, there's been, and this is a national problem, there's been communications that younger people are less at risk, they're asymptomatic, etc. And then they don't realize they're bringing the virus home. And if they don't realize that bringing the virus home can have a negative impact on the health of a family member, that's where we're seeing, I believe, a lot of transmission, where someone who on their own probably took a lot of precautions, but someone they live with didn't take as many. And so there just needs to be that kind of awareness where, you need to understand that if, your mom or your dad or anybody in your household that you're living with has these pre-existing conditions, then bringing the virus home can be very devastating for them.
Thank you. Yes.
We also need to consider perhaps whether or not those with pre-existing conditions may want to opt in to government resources being provided for their isolation, so that if we choose to open things up further, those who are at greater risk can receive government support for taking the healthcare precautions they need in order to not expose themselves as things become more relaxed. So instead of having a wholesale approach of all or nothing, lock everything down or open everything up for everybody, I think a more targeted approach for those who have greater risk factors and for those who reside with them, informing them and providing them with resources to take the health precautions they might want to over and above what every establishment should be setting as a baseline, I think could give us a roadmap to finding that balanced approach. Thank you, Madam Chair.
Thank you, Congressman. Yeah, I think you would appreciate tuning into our 4:30 roundtable. That's exactly what we are talking to public health about, is their efforts to take care of those in the community who are at high risk or who are positive cases, so before they deteriorate. Anyone else who would like to answer that question? Congressman Underwood.
We can't hear you. We can't hear you, Congressman.
Well, we can't have that, Tello. Yeah. So thank you for reminding me. Thank you, Madam Chair. And I just want to, I think the original question was, how do we communicate this information in a more effective and efficient way to a community that may not be fully understanding the messages or may not be fully accepting the message? And of course, that's a very difficult problem. It's a problem that goes around the world. Sometimes young people think that they're impervious to every trend. No, I'm on. Yeah. So the issues remain. How do we communicate that in the context of Guam? I think basically we have to go to community leaders. We have to go to community representatives and people in various communities, and we know where these are. And we have to utilize them as spokespersons and as individuals who can convey the authenticity of these messages, which are absolutely necessary to convey. We should use different languages in order to convey this information. We should use, as the Archbishop said, they have a network. There's also a network with other religious institutions, with preachers in other faiths, as well as priests in the Catholic faith. All of these opportunities present themselves for communicating a message. And I don't know how effectively that message has been communicated, but we should certainly utilize these vehicles. And then in addition to that, of course, we use the standard institutions that we normally use to communicate, educational institutions and public service messages through public health and social services. But the most important thing about communicating a message effectively is that the message itself be comprehensible, and that the message itself be clear and consistent. And so that is really the key to this. If the dynamics, if the goalpost keeps shifting, or if we're not clear, like in one situation, you may allow this, in another situation, when you do that, the communication structure sort of breaks down. So there's a lot of pressure, I know, on public health to be able to come up with consistent messages. The most common, is the daily announcement that comes out. That is the major vehicle by which people circulate all of this information. And that information, that update, that daily update should be in a more comprehensible way and should offer 2 or 3 or 4 tips based on what they have learned as a result of those experiences. And so in terms of communicating this, there's no one single way, but certainly the use of community leaders, the use of intermediaries in all the various communities we have. We have one Guam, multiple communities. We like to think that we're one family, but we're actually many different families, and we're many different generations. And utilizing all the tools available to us to reach those different groupings, those different communities, is absolutely essential. And so that it doesn't look like public health is just, stigmatizing one community over another, that it's actually a collaborative and cooperative venture. And that would be done with community intermediaries. And there's a lot of them. And they're people that can perform that role, people who have who are seen as wise, people who are seen as stable, and people who are seen as people who can deliver accurate information. So you have a messaging, you have a message issue, make sure it's consistent, and then you have the message implementation, which is multiple sources. But this is, I have to say again that what Senator Muñoz has done has actually helped create the context for a lot of avid conversation that's going to occur, regardless of whether the actual constitutional rights are under any serious strain right now. Thank you.
Thank you very much.
Someone's calling me.
Thank you. I wanted to ask the director, Art San Augustine, is that public health, when they change the proposal to change the penalties from criminal to civil violations, do you believe public health will be effective if those penalties are changed?
Madam Chair, with regard to the penalties being changed, I think one of the earlier speakers mentioned this, is just to really put more details into what those civil penalties would actually translate to. So that it's very clear. Is it like, for example, if someone doesn't comply, for example, with an executive order, and it's your first occurrence versus your second or your third, it's never really been the position that we are wanting to criminalize the process. We are part of the community, and as the former congressman also noted, that with regards to civil, it doesn't, I believe he said, goes on their record. And so we don't want to hurt anyone's employability for future employment if they're not already employed. But in terms of the civil violations, it's really listing that and putting that, and that's a really good point, because if we don't define it, as many of you know, then it's like, well, is there an existing civil violation that's already existing? Then we kind of try to tie it to it, but I think it really has to have its own defined in this provision of proposed bill. So,
All right. Yeah.
Thank you, Madam Chair.
Thank you, Director. Yes, some of my questions are in, relative to that regarding the legal. So the legal questions, I mean, of course, we have these rights. Are they being violated is one. Second, can they be violated under these conditions or not? And what are, or is there a more narrow way that we could, put restrictions down without violations of these types of rights? But I guess just in general, I'm familiar with the cases against public health regarding quarantine and the outcomes of the cases that I've seen. Are there constitutional challenges that public health is facing in court right now?
There are, what I can say, Madam Chair, is that there are some cases in court, and because I'm represented, the department is represented, and through me, the AG's office, I basically been advised not to comment in public about it because there are still some active cases. And so I do apologize that I'm not able to articulate to your question, only because of the active cases that we have.
All right. And does the Attorney General of Guam assist, or does that office assist your office in developing the guidelines that you have mandated all businesses to run through your office?
Actually, the guidelines, Madam Chair, they're developed in concert with the group. I have the incident commander today, Mr. Nadeau. He oversees, prior to his IC assignment, the Division of Environmental Health, and we get some legal input as well. And then he uses the environmental health codes in terms of business application, and then he puts the guidelines, we review them. We've actually brought in more people in, some medical, infection staff, so that they can look at the guidelines and they provide input, and then we issue them out accordingly.
All right, because I'm hoping, that we can, address any potential issues at that point, right? In the guidance to businesses in opening. All right, and okay, so the deputy director testified. He mentioned 3 conditions that he was concerned about. I think he was talking about churches at the time, and he mentioned aircon, and that all ages were present at the same time, and that they were meeting for more than 15 minutes at a time, which is in excess of CDC guidelines for safety. And I was thinking, if we apply that to all businesses, it's not really applied across the board, it seems to me. Maybe you can correct me if I'm wrong, but for example, our post office, we have long lines at the post office. We have all ages. I've received so many complaints from elderly citizens who are very concerned with their own health, but feel that is their only alternative to get their mail. And I'm wondering, how do we control these venues, all venues, and make them consistent if those are truly the causes of concern, the aircon, the more than the number of people, the ages gathered together, and of course, more than 15 minutes at a time. The waits at the post office are sometimes in excess of 2 hours. I've heard of 4 hours. I mean, maybe Congressman, if you could help us with that, that is really outrageous at this time. And no benches to sit on, things like this. So I don't know why, but they've said to have increased their hours. But Director, back to, so we've got, pockets of activity on Guam that seem to operate notwithstanding those 3 concerns of public health. So how important are those concerns, and what are we going to do to make things consistent? I think for me, that's what the people always want. They want to see consistency.
Sure, absolutely, Madam Chair. With regards to those measures, let me first go with the post office. We too have received numerous complaints with the post office. Congressman, if you're able to assist us, but we've been advised, and Guam Police Department actually has responded. They reached out to the postal staff and they were very receptive. Unfortunately, the postal facility itself is a federal asset. And so, Congressman, if you're able to assist us, we don't have reach to that situation. And if you're able to assist us in that, the department would be very, very appreciative. With regards to the areas that I believe our deputy was talking about was the CDC guidelines, social distancing, and then your exposure time of 15 minutes or greater, and maintaining social 6 feet or minimum 6 feet between individuals. So that is always a part of the process when we are discussing the openings of different activities or events. So let me share with you, for example, the parks. In the discussion with the parks, it's an open area. I'm sorry. We're in discussion with the parks, it's an open area. You can maintain social distancing. So that is different from if you're inside a place of worship where the area is contained and limited. So that's those are some of the variables that are looked at when we are looking at where we can open more safely and expand it and watch the numbers in our community in terms of community spread and how we are able to contain the virus. And what we're trying to do is mitigate any potential outbreak in any of the confined areas where there's not the ample space for individuals to be maintained for an extended period of time. And so that's, I don't know if our deputy would like to add further to his comments with regards to his reference perhaps with ERCON and the social.
Well, my question is, are those 3 points, for example, solid points that we have to enforce across the board, or do they vary based on who's doing the activity?
It's not so much who is doing the activity, it's about the type of activity. If there's contact, no contact, can the activity be done in small groups, spaced between the participants? Can it be done in a way where it minimizes any potential transmission? So in looking at social distancing, that's one element that we do look at, Madam Chair.
All right. Okay. Thank you. I'm going to.
Sir, may I comment briefly on the post office concern?
Sure.
Yes.
Sorry.
Yeah, I agree that the post office situation is very, very, it not only presents a risk factor, but a serious inconvenience for our public. But we need to also be mindful of the fact that the post office circumstances are a direct result of the lockdowns and the shutdowns, because we are preventing our community from being able to go to local businesses and local establishments to be able to procure the goods and the products that they require. And because there's an inconsistency in the availability of those at a local level, people's behavior is adjusting. The post office has publicly stated that their volumes over the past months have exceeded their regular Christmas volumes. And so the post office has now become a proxy in the absence of being able to procure those goods locally. We're kind of bottlenecking the resources into that procurement channel because the ability to procure elsewhere is taken off of the table. And that's another example of pent-up demand going out and trying to find a way to be able to get the resources that they need. For the public, I want to inform them, and particularly those of health concerns and who are at risk, if you give a power of attorney to somebody to pick up your mail, they can pick up your mail. I think that the government could probably try and facilitate that in some way, providing notaries or what have you. And then we also need to explore whether or not we can somehow incorporate the National Guard, for example, that's already been activated for this purpose, to be able to be given some kind of authorization from a post office patron who perhaps can wait in their car and provide whatever documentation the post office would require to allow for a National Guardsman to be able to retrieve the mail for them and bring it out to their car, versus having various random people inundating the lines. At least we will know, with the guardsmen, who's in line, and everybody can have a greater degree of confidence that, we don't know if, or we will know that there isn't anybody in this line who's necessarily sick, because we're having these individuals tested, and they're the ones facilitating the retrieval process. So that's really the situation with the post office. We've been in communication with them. Their circumstances are such where their operations are based on national allocations on a pro forma basis. And so it's not like we can just walk in there and say, you know, we need to get, you know, push more to Guam. We would like to, but in the meantime, we just need to understand as well that these demand circumstances are a direct result of the actions we have taken, and the bottlenecking is because the public is going to go and get what they need where they can get it. And that's why it's important for us to be considering this more balanced approach that I believe this legislation represents. And I think that we can perhaps get more creative in finding solutions to keep our more at-risk community from having to stand in those lines. Thank you, Madam Chair.
All right, thank you. I need to move to the next bill. So I'd like to, again, thank everyone for being here, for your valuable testimony, and you may submit anything in writing that you would like to my office. And I would invite the sponsor of this bill to now close on the bill. Thank
you so much, Madam Chair. And again, I want to thank all of the participants for being here for the last 2 hours to listen to the testimony and to provide testimony and to ask questions. It definitely isn't a waste of time if we have this many people on and sit through it. I want to thank the Archbishop for for getting the masses online. But as a Catholic, I know the importance of celebrating the Holy Eucharist in person. And when the churches first closed down the first time around, and there was a big hole in my heart. It was going to pray in the house of the Lord was so important to me, not just in my success of life, but even in my darkest moments. And I think this is a dark moment. I think everyone is going through a dark moment now and needs that sense of comfort. And that's really what the house of the Lord offers, because we can pray anywhere. We can talk to God anywhere. But when you walk into a church, you just feel so connected. And I think that's really, it's kind of funny because going online and going to church, it's kind of awkward. And I close my door and you could hear me saying the Lord's Prayer really loud all by myself. I feel so much better when I'm praying amongst other people who are with me in that same heartfelt moment. And I think that's really what the church brings. And it really should be an essential practice for anything to bring God into your life. And that was one of the main purposes of me putting out this bill, so that we can continue to have allowed this opportunity for people to go and express whether they're thankful for life or praying for healing or for whatever it is that they need God in their life for. And not just the Catholic religion, but all of the churches. You can see they're all trying to reach out to people, and it's really hard when you can't and you're told not to. So I just want to thank the Archbishop for that. There's a photo that I've been told, and I've seen it, where an older lady, a Manumku, and she's kneeling down in front of the doors of the church praying. That's really heartbreaking. And you can tell that not just our Manumku, but our people need God. They need him now more than ever. I wanted to ask Public Health, maybe Art San Agustin, if maybe the CDC or the WHO has provided some guidance on how to safely hold, churches during the pandemic. Have they given any specific guidelines?
To your question, Senator, I will provide feedback at a later time. I will go back online and see if we have more recent guidelines on places of worship, and then we can send it to perhaps the chairperson or to yourself or both of you. We can provide you the latest that we can find online.
Thank you. And I do want to commend the church, Archbishop and Poly Mike. Poly Mike's one of my favorite priests. Don't tell Father Paul that. But I just want to say thank you for providing us a safe way to return back into the church, and probably one of the safest places to be in. If you take a look at some of our grocery stores, maybe not even as safe, and they're still classified as essential. So I really want to thank the church and the Archdiocese for making it very safe for us to come back into the house of the Lord. I do have maybe a question for Congressman, and this was actually posed to me, and you're probably going to have to forgive me because I'm more than likely going to butcher the names of these compassionate drugs, but there are some compassionate drugs out there that are being offered that maybe are not yet FDA approved, like monoclonal antibody therapy. There's also a convalescent plasma from like blood donors who recovered from COVID-19. There's a remdesivir, I think that's in clinical trials still, and an off-label use of dexamethasone. It's a steroid drug prescribed for inflammation. Is there anything, Congressman Nicholas, that you can do to get Guam access to some of these compassionate drugs?
I can definitely look into it. I'm very careful about promoting any alternative treatments that the medical community has not adopted at large. I know the president, when he was treated, I believe I recall 2 of those drug names coming up in his treatment regimen, but whether or not they are generally available to the public, I'm not sure. I know that all of the methodologies that are being employed now on a general basis to the public are what have been adopted as the treatment regimens by the CDC and the NIH. But definitely, I don't think there's anything necessarily precluding Guam specifically from being able to utilize regimens that have been adopted as a normal course of treatment. But if you can, or if anybody you know on the panel could inform me that there is something that they're aware of that is available elsewhere and not here, I will absolutely do whatever advocacy I need to do to make sure that we are being able to access any similar treatments that are available in any other jurisdictions. Art, if you can let me know, public health, just shoot me an email and we'll absolutely get on top of it if there's anything that we're not able to avail of.
I mean, thank you, Congressman. If it's okay, Senator Luisa, yes, definitely will do that, Congressman.
Thank you again. Thank you. This is to address Ron Laguarnia. Sijus Masi, thank you so much for being here to testify on behalf of the bill. And it is a good discussion for us to talk about the 6 points. And you know, Senator Moylan mentioned that there are only 6 points in this, but you know, the Constitution is a big document. It has many different points in there. Why I specifically chose some of these is because I recognize that some of these are what some of the concerns are of the people. The bill applies only to GovGuam penalties, though. Unfortunately, I don't want to make people criminals who don't wear masks. That's what's on the bill, right? There are enough bills out there that do address rents and mortgages and late fees in the legislature and in Congress that we will keep an eye on. You know, this bill is not duplicating that. If you take a look at the Guam legislature site, you will see that probably from Bill 310 all the way up to Bill 420, this is over 100 bills that are they're correlated to COVID and our situation now. So the legislature has been putting in the time to address all the specific areas of concern, including the excessive fines that you talked about. So you could reach out to our office. We'll definitely assist you and see if there's a certain bill that could address that issue. Thank you, Ron. And again, I want to thank everyone for being here, including our former Congressman Underwood and then Congressman Mike Nicholas and Archbishop Michael Burns. I hope you're healing well from your hip surgery, and I sure hope that one day you can guide me and maybe give me some advice, because I think all my colleagues know that I have a hip injury as well too that I probably going to need to fix soon. And thank you to Polly, Mike, and all of our colleagues here, but most especially to public health. I mean, they're practically going to be with us all day long, you know, from this morning all the way through lunch, and then even to this afternoon. Thank you so much. And I do understand that there, you know, I'm sure there's a lot of other things that you should be doing, but you're here addressing these issues with us. Just in summary, Madam Chair, the government can develop guidelines and assist churches to operate safely. The government can delay firearm registration and ID renewal until after the state of emergency is over. The government must fairly compensate people whose property it seizes. The government must never make criminals with lifelong criminal records of people who exercise their freedoms. There are no reasons and no excuses as to why this bill should not be law or force our leaders to protect our constitutional rights. Again, the Constitution of the United States can be summed up in just 3 words: we the people. Unlike the constitutions many other countries where people's rights are delegated by the government, our Constitution says that the people are the masters and the government is their servant. In our Constitution, we tell the government what it can and can't do. In our country, we the people are in charge. Thank you, Madam Chair.
Thank you very much, Senator. Again, thank you to the panel. Thank you very, very much. And all of your comments will be incorporated into our committee report on this bill. We are going to move now to the second agenda item, which is Bill number 399 COR, introduced by Senator Will Castro. And I would like to just take this time to recognize my colleagues again who are still here. Vice Chair Senator Sabina Perez, Senator Terlaje, Senator Kelly Marsh Taitano, Senator James Moylan, of course, Senator Will Castro, the author of the bill, Senator Mary Camacho Torres. And we will begin with the introduction of the bill by Senator Will Castro.
Today, Madam Chair, thank you for the opportunity. I don't know if it's divine intervention or the stars are aligned, but to have 2 congressmen here, the Archbishop, Ali Mike, and my minority leader, I'm going to take, and to have the bill introduced and heard within 1 month. Thank you, Madam Chair. So I'm going to take full advantage of this lesson in humility. If I may, I'm just going to go ahead and proceed with the opening remarks, Madam Chair. So good afternoon, and thank you for the opportunity, Senator Therese, and thank you to my colleagues for the opportunity to speak on Bill 399-35, Committee on Rules. It's an act to add a new section 1903A7 and a new section 19406 of Article 4, Chapter 19, Title 10. Guam Code annotated relative to the renewal of declarations of public health emergencies. Before I get into the details of the bill, Madam Chair, I'd just like to establish this caveat. I had a conversation, I'm communicating with a couple colleagues on the side, given the recent passage of Bill 90, and also in collaboration with Senator Perez on Bill 386. So I just want to advise everybody that this conversation, as fluid as I hope it could be, should be taken in the context of both bills. It was said earlier that we're definitely in a very trying and unprecedented time with these COVID circumstances. I'm sure many have come before us who have served, and many who are hoping to serve in the 36 couldn't imagine a more challenging period in our history. And so while the current statute governs declarations of public health emergencies, and many believe it's comprehensive, also extensive, our current experience has taught us some lessons that we can use to close some gaps, as Senator Perez addressed earlier, and address controversies that may have come about as a result of this pandemic. This is the first time I've had a bill where I didn't get a chance to put together 2 or 3 working roundtables, but nonetheless, appreciate your participation. The bill in a nutshell first requires certain findings and implements conditions under which a declaration of a public health emergency may be extended. Title 10 of Chapter 19, subsection 19104M defines a public health emergency. Article 4, Section 1401 authorizes Imagahaga to declare a state of public health emergency as further defined in 19104, subsection M, after consultation with public health authorities or if expediency is necessary without consultation. Section 19405 governs terminations of states of emergencies. Now, while 19405 Section B does discuss renewals, Madam Chair, it's within the context of preempting an automatic termination. And so the initial declaration of the current state of emergency in response to the coronavirus may have occurred on March 13th. I like to just note for the public record that we've actually had seven extensive renewals via executive order on these states of emergencies. And it's quite concerning. And this demonstrates to me, Madam Chair, in my mind, that the renewal should be explicitly addressed in the statute. This bill, as imperfect as it may be, attempts to take findings and conditions under which a public state of emergency may be terminated and inversely applies them to renewals. It does not attempt to limit the governor's authority in any way or inhibit her ability to renew a declaration. Rather, it will simply require the governor to demonstrate that the findings and conditions have been met in order to renew the declaration. Second, reactive procurement laws and regulations while in a renewed state of emergency. Since the governor's declaration, Madam Chair, initial declaration, as I referenced earlier, Executive Order 2020-03 on March 13th, of a state of public health emergency, we have been made aware of questionable procurement practices. And understandably, and was the intent of our predecessors and other bills, as I referenced earlier, granting the government extra broad procurement powers and attempting to correct that in a state of emergency would allow the government to act in a rather precarious way when faced with decisions. I listened extensively to the public hearing on Bill 90, and I couldn't agree more that there are evidences of abuse of emergency procurement authorities, and not necessarily for public health emergencies, Madam Chair, but also in other types of emergencies. And I thank Senator Sabina Perez for correcting that. However, I do believe, as mentioned, that the authors of the current law governing states of public health emergencies meant to provide unfettered, unchecked procurement power for an unknown extended amount of time as we are currently experiencing. Further, in light of the dire economic outlook we're facing, I feel it's our responsibility as policymakers to improve upon the existing law, to make the necessary adjustments to the current situation, and to implement measures of strict fiscal accountability, even and especially in a state of emergency. While we're definitely in a state of public health emergency and all efforts need to be exhausted to ensure the safety of our community, we're also in an economic emergency, and we can't afford to continue for extended periods of time without serious procurement regulation. This measure attempts in its original iteration and what we have today attempts to call for reactivation of procurement laws and regulations during renewed states of emergencies. Simply put, in an initial state of public health emergency, 30 days or less if declared, the governor would have broad procurement authority provided for in the current law. And so all procurement after the initial declaration and upon renewal of said declaration would be subject to existing laws and rules. And keep in mind, I did mention earlier, Madam Chair, assuming that Bill 90 is signed into law, this extends that procurement, emergency procurement opportunity to 90 days, provided that a certificate of need is signed and a public hearing is held. I crafted this bill with the understanding that it may be overly simplified on parts of the bill, but I'm here today to listen to you. I'm actually quite humbled that I have the former senator and chairman of Ways and Means, chairman of Rules, to provide some input if he's still here, and also the former congressman who could provide a different context by which we can examine the bill on its face. Yesterday, for the listening audience, if you're not aware and you just heard, you're not clear, Bill 90-35, which seeks to improve emergency procurement, was passed yesterday by the body. And so I think that this bill benefits from the passage of Bill 90, and it certainly could be amended and improved upon in light of the bill's passage. So I'm excited today. We were going to initially pull this bill back and have a conference discussion with Senator Sabina Perez, and I look forward to her input this afternoon, as well as yours, Madam Chair, on how this may complement, if not take certain provisions of my bill and insert it into 386. And with that said, I'm wide open to criticism, input, or any other types of feedback we can get from everybody who remained on this panel. So thank you. And by the way, for the record, I was ruled out of order. We couldn't go straight to the congressional debate forum questions. So have that.
Okay, thank you, Senator. I want to state as committee chair for the record that BBMR's fiscal note on this bill says that the bill adds measures for fiscal responsibility and accountability, where upon renewal of an original declaration of a state of public health emergency, all applicable laws and regulations shall revert to full applicability and enforceability. Legal review by Legislative Council is also still pending, and there's been no submission or testimony by the Attorney General. All right, so we will now open it up to the panel, and I did not receive confirmation except at this point from Congressman Underwood. Congressman Nicholas, will you be testifying? And Mr. Leon-Guerrero, will you be testifying as well? Okay, all right, so we've got 3, and the Director of Public Health. All right, so Congressman Underwood, or Congress, I guess it's been our tradition to allow former colleagues to begin. If Congressman Nicholas would like to begin.
Thank you, Madam Chair. I first want to open with, I understand where this bill is intending to go in terms of allowing for the circumstances to be revisited on a 30-day rolling basis in order to determine whether or not the actions taken, the scope of which and such can be fully debated. And I think that's healthy. I think that definitely is a component of how the system needs to be built out. I believe, if not 6 years ago, then 4 years ago when I was in the legislature, I introduced legislation to try and mandate operational continuity plans throughout our government. That legislation was not successful at the time. And, looking back with the benefit of hindsight, it would have been really, really good if we had those things in place under these circumstances. That being said, this bill, I think, does fill a necessary void in terms of constantly reevaluating the lay of the land and whether or not actions that have been taken should continue, and properly putting the debate into the public sphere for context as lawmakers deliberate and as the executive branch continues to execute. That being said, there is one component here that is missing that I think is critical, and that is that in the event that the legislature, for whatever reason, is unable to convene, there is no mandate or there is no established statute to authorize the legislature to convene in a manner that would allow them to address this if in the event that it passes into law. And so, for example, I recall during this pandemic, there was a point in time prior to the rules being adjusted for these kind of hearings to take place, where the legislature was kind of frozen in place, and action wasn't able to be taken until those rules were adjusted. Rules, as we know, my former colleagues and sitting senators, rules change on an ongoing basis, legislature to legislature. I think that we need to statutorily establish an operational continuity plan for the legislature if the legislature is going to be the required gatekeeper for a rolling 30-day timeline on evaluating emergency declarations. Because worst case scenario, we passed this law, but we don't have that in place. And then for some reason, the legislature is unable to reconvene. This law will basically tie the hands of the governor from being able to do anything. And so if we're going to have this as a component of a proper checks and balances, we just need to make sure that the body that's going to be responsible for reinitiating another 30-day rolling window is actually statutorily going to be able to have the basis to be able to do that. And so I would recommend that as either an amendment or a companion legislation, an equal mandate be put into place that would require the legislature to somehow be able to continue operating and not just rely on it to be a rule, but actually a statute, so that regardless of what rules are adopted, in the event that rules change or time passes and people kind of forget about why a particular rule was in place, the statute would be the safeguard in the event that this 30-day window would become an area of concern. That was the only suggestion I had on the legislation, Madam Chair.
Thank you very much, Congressman Nicholas. We were having issues at the time as well with the Organic Act limitations, so just to put that on the record. All right, Congressman Underwood.
Okay, Congressman, unmute.
Thank you very much. Thank you again, Senator Tite, for reminding me. She was my student in high school. So I want to congratulate Senator Castro for this bill. This bill actually endeavors to solve a problem which other bills have attended to, which is the extent to which an emergency declaration can continue on. And I have to say that even though there was a lot of confusion in the beginning and trying to deal with what is open meetings in this environment, what are procurement rules in this environment, how are decisions made in this environment, all of these issues have been continued to surface, and some have been successfully dealt with. I will leave it up to, I'm not running for the Guam legislature, so I'm not going to try to figure out what the Guam legislature's role is exactly in this particular issue. But there are a couple of things that are attended to here, and that is the role of the executive branch in declaring an emergency and the role of the legislature in ensuring that an emergency doesn't go on indefinitely without some serious checks. And one of those is procurement. And when you raise the issue of procurement, there's always the kind of suspicion that maybe trying to secure goods and services on an immediate basis means that you suspend the normal processes which lead to more efficient purchases and more ethical purchases. And so there has to be that level. And so in order to be able to move this legislation forward, and I know that Senator Castro is also scheduled to meet with Senator Perez on this, there has to be evidence that there's something amiss in the process, but basically, this is a call that you have to make as members of the Guam legislature. And, there's always a case of balance. And that balance goes back to the original declaration of emergency and what are the details of that and how do those change over time. So maybe there are gradations of emergencies in the same way that there's P-Core 1 and P-Core 2 and P-Core 3. Maybe there's some room for kind of maneuvering that kind of refinement of definition into the procurement process. But I don't, as I said, I'm not running for the legislature, but I trust in the wisdom of the sitting senators to be able to craft a positive solution for this. Thank you.
Thank you very much, Congressman Underwood. We will hear now from Mr. Leon Guerrero and then the Director of Public Health.
I'm testifying in support of this bill. My biggest question is, why wasn't this bill introduced in April session, May session, June session, July session, August session, or September session? The biggest problem we have right now is a lack of public confidence in the leadership of the government throughout this pandemic. Here in the public, we see how some people are forced to go into quarantine, but some people are allowed to bypass quarantine. We see how some businesses are publicly held out as good examples of bad examples, and other businesses are protected against disclosure. So for this bill to pass would be a good step towards restoring public confidence in future pandemic or emergency type events, because the 30 days gives the governor all the room she needs to get a handle on what's going on. After that, there needs to be a much higher level of scrutiny on the actions and the expenditures and how those expenditures are playing out, something that we still aren't seeing to this day. And so that's why I'm supporting this bill. I think it could be made stronger by requiring a full financial report as part of the application process for extension. That way we have a second level of scrutiny on the administration, their actions, their expenditures, which we all can agree have not been flawless or above board, and they are very damaging to the reputation of government of Guam as a whole in the eyes of the public. And it's an incumbent on the leaders and elected representatives and appointed representatives to rebuild the trust that our people used to have in the government, but we don't anymore. I mean, everybody I talk to is, well, not everybody, but a lot of people I talk to express their concerns that this is a hoax, that this whole emergency situation is just being kept alive so that the local government can continue to milk the federal fund cow. And it's hard for us to debate that when you pass a budget that's totally boggles everybody's mind, because here we have an economy that's in utter destruction, circling the drain. You pass the second biggest budget in the history of the island, and there's a caveat that we're counting on federal funds to make up the shortfalls. That doesn't inspire confidence among our people. So I support passage of this bill. I think 30 days is enough time for the governor, whichever governor it is, whatever pandemic it is, to build a compelling case to put before the legislature so the legislature can act as the people's eyes and ears on this situation. And just one other example of why the people don't trust the government. The media are supposedly the eyes and ears of the people, but when the administration is muting reporters because they don't like questions, or limiting reporters to 2 questions. Here we are in a pandemic. They're issuing reports about death and infection rates and hospitalizations, but reporters are only limited to 2 questions. Do you realize how that comes across to the people? It's like the government's trying to hide something. And then, going back to this procurement aspect, here the federal government is offering government of Guam a full-on mobile military hospital at their disposal. But what does government of Guam do? They want to buy a portable hospital. Now we're talking about a government that has no credibility maintaining anything from swimming pools to the air conditioning units at the skilled nursing unit. And now you want to spend $1 million to buy a portable hospital that we don't even need yet. But in the event we do need one, the military has one on island and they can put it up before the one we bought ever gets here. So these are the issues that need to have that extra layer of public scrutiny that would come through a series of public hearings on the extension of an emergency order. And I think that how those public hearings are handled will be enlightening to the public, help build confidence for the public. But we're not seeing that right now, because here we hear the World Health Organization and the CDC are advising against lockdowns. What are we doing? We're still locked down, So that level of disconnect between the people and the government is only going to continue to grow. Suspicions are going to continue to build as we see more and more examples of politically well-connected insiders getting sweetheart contracts. I know people who brought in disinfecting supplies and PPEs, and their products were held in customs, while we have auto dealers and tailors who don't even have license to sell disinfectant, cleaners, and PPE getting $1 million contracts to provide these types of materials to schools that are closed. So that's why we need to pass this bill, because in 30 days is enough time for the government to establish a clear and compelling case on why this needs to go forward for the people. Because the way the people see it right now, this is a perpetual state of emergency designed to drain federal funds out of public accounts into private accounts. And that does not help public health at all.
Thank you, Mr. Leon Guerrero. Director Art San Augustine, Department of Public Health and Social Services.
Thank you so much, Madam Chair. With regards to the measure before us, the way we're reading it is that if this is an intent to do exactly as earlier discussed, one, formalize the process, but while we're still utilizing our existing procurement provisions upon the renewal of any original declaration, we could support this. We have in both provisions, the amendment to 1940387 as well as 19406. The only thing really we are looking for is a reminder that as we move forward with procurement provisions, that there is no playbook. We've heard that. We are working with a novel virus. It's emerging, it's evolving, and there just still needs to be provisions for some quick action from the procurement perspective. And as long as we maintain that, that'll help public health and other entities that are in the response mode, something that is rather urgent, quick response. In terms of transparency, the county, all that, I support such transparency. The people, the legislative body, definitely important that we let you know what's going on with our spending. We can never really say that that's not a critical aspect of our local community. But today, in terms of me being here, we're not using emergency procurement in the acquisition of for example, our services right now. We're using the standard traditional procurement processing them through general services. The only other aspect that we have is Guam Homeland. But for example, the acquisition of our RNA extraction kit, although it's funded by federal dollars, and it is part of our effort to build our lab capacity testing that was done through a requisition issued by the department. We need flexibility, and there was a provision mentioned earlier about being sure that the legislative body would be able to meet. And perhaps that's the part that I'm not seeing at this point. But in terms of the extension, renewals, transparency and accountability of what we're doing, I would support a measure that calls for us to do that just for the community. I think educating the community in terms of our activities, our finances, and our next steps, all that has been discussed really between this measure and the measure before us and the Bill of Rights, they're all related to our response. The only thing I would ask that we please not do anything that would limit our ability to respond timely, be it for the governor, or be it for public health, or for a service that needs to be put in place. There always needs to be that measure that would allow us, if it's acquisition of supplies and material, PPEs, protective personal equipment, and that we have a short time that we be allowed to do that. Filling out reports is administrative, and if it's a public health requirement to do that as well, or however the legislation designs it, we'll have to do our part and to provide that information to you. But the renewal of the executive orders and the use of the existing procurement process is something that we are using today. Again, I do want to make a note also that we are, through Homeland, has the ability to procure services during our response effort. And so we'll never disagree about being transparent to the community. We need to share with you what we're spending, how we're spending our funds. Although not part of this procurement discussion, sharing with you that we are working on providing information regarding our CARES Act funding, which is in line with the COVID-19 response, so that the community will have a better sense and improved sense or hopefully an appreciation of how these funds have been awarded, the funds that have been awarded to Guam, how they have been used and how they will be used, either in this fiscal year and the fiscal years to come. And that's really all we have to say about the measure. It's just please maintain our flexibility to be able to respond to the health crisis. Be it this pandemic, as Mr. Linger, you said, or the next pandemic, we just don't know what the impact would be. And that's why they're called, a pandemic, because it's a novel situation. In this case, it's a novel virus. And we just need to be able to be flexible and quick acting to contain and to protect the people. So thank you very much, Madam Chair.
Thank you very much, Director. I'd like to acknowledge the presence of the Deputy Director Duenas again and Deputy Director Uggan. Thank you. Could I just ask you, Director, if this bill had been in place, would your recommendation, while you have been director, have you made a recommendation to continue the health emergency declaration?
Yes, based on not so much the procurement aspect, Madam Chair, but more the emergency declaration based on public health aspect. This is primarily for procurement, right? But in terms of our numbers, our hospitalizations and things like that type of data and the community spread, that's the angle from that's where we're coming from. The procurement, sorry.
Did you ever make a finding that high probability of a large number of deaths in the affected population, a large number of incidents of serious permanent or long-term disability in the affected population, or a significant risk of substantial future harm to a large number of people in the affected population?
Well, more recently, Madam Chair, with regards to our rapid engagement team, which will be sharing with most of you, or if not all of you later this afternoon, that would fill the renewal purpose in one area that you're talking about, a high probability of a large affected population, and maybe more in terms of incidents, and then perhaps this could be revisited in terms of not just deaths, but cases, and then high incidence cases, and not just deaths, because in some situations today, they may actually meet both requirements, but in future situations, it may not. And so with regards to, sorry, Madam Chair, with regards to the, okay, thank you, Madam Chair. With regards to the rapid engagement team, which we'll present later, you'll hear how we're looking at the northern based on data, and that would be our probability of incidents.
Okay. Art, could you just speak up in the future? And I'm going to yield now to the sponsor of the bill, Senator Castro, for any questions to the panel.
No, I don't have any follow-up questions to the panel, Madam Chair, but I do have some closing comments, and if anybody else would like to contribute, that'd be fine.
You will definitely be recognized for closing comments. Vice Chair Sabina Paris, Senator Paris.
Thank you, Madam Chair. So yeah, I just want to clarify some testimony that you provided, Director San Agustin. So in your experience, does emergency procurement satisfy the needs of the Department of Public Health and Social Services during this pandemic?
When you first start off and you're responding to please let me know if you can hear me, because I'm not sure why perhaps it's my desktop unit. Maybe I need to change it out.
That's better.
Okay. So with regards to the initial, what I understand initially, as I was not here back in March in terms of this position, that emergency procurement was critical to access services and goods. And so when you first are responding to initial, yes, the emergency procurement has value and place in terms of us being able to mobilize our resources and our services so that we can respond quickly to your question.
So basically emergency procurement requires 3 quotes. Is that sufficient to respond to a public health emergency in your view?
Well, the procurement, once we send it out, it's really just fast track. We have a team that works on it, sometimes through our department and sometimes in partnership with Homeland. So what I know from the beginning is that it did work. Today, I can speak from the time I'm here. We seem to be able to acquire the services and goods that we need in our response effort at this point. I haven't had a major roadblock with the current procurement process in place, ma'am.
Okay, so yeah, that's what this Bill 399 does. It basically closes the gaps in Emergency Health Powers Act to ensure that any kind of procurement that is done, it follows existing laws. And so I just want to be very clear that should this bill be passed, that it basically satisfies the needs of the response to the public health emergency. So I just want to get that clarification.
All right.
Okay, thank you. And so just a note, GSA did reach out to me regarding this bill. So they do have they would like to resolve with the passage of Bill 90. They feel that there might be some refinements that need to be done to resolve any kind of issues with that one. So yeah, that's all the questions for me right now. Thank you. Thank you.
All right, thank you, Senator Paris. I welcome the input from the GSA, the Chief Procurement Officer. Senator Kelly Marsh Taitanu.
Situus Maasi, Madam Chair. And, you know, it's been good to hear the different points of view regarding the bill, and it's good to hear that it has a lot of support and that it's balancing the needs of the community, the needs of the leadership to have certain flexibility, still be able to meet needs, but of course, wanting to close gaps. And, you know, it just reminded me of some of the work from the fields that I'm from. And when they write reports, the first part of the report lays down the baseline from beginning to end. And I could see that for this bill of every time there's this renewal, I think it would be a good standard practice to reaffirm all of those varying directives in you know, in an orderly fashion, but it reaffirms all of it, including whether there is this need for procurement, emergency differences and things like that. And I think it does a couple of good things. I think it's good housekeeping, and it keeps things orderly, findable. We have, you know, a large number of executive orders now, and when we go looking for things, it can take some hunting and finding down exactly which executive order it is. But if with each of these executive orders, it was just a standard practice that everything is re-examined and reaffirmed, at least just the parts that still need to continue to move forward. It makes it much clearer for everybody. They have re-evaluated what conditions are applicable. Everybody can see it and re-evaluate it as well. And everybody knows for the next 30 days exactly what is applicable. So I do see that that this bill does good things, and I would seek to maybe expand it a little bit, like I said, and just have all of those varying directives that accomplish different things perhaps be reaffirmed, so that, as I mentioned, there's reevaluation, there's clear understanding in the community, and just everybody has a chance to reevaluate and examine exactly what's going on. So I don't have any questions right now, but if I do, I'll let you know to see if I can ask them. So just Masi.
Thank you very much, Senator. Senator Terlaje.
Sijus Masi, Madam Chair, for the opportunity. And again, thank you to Public Health who's here today, who's sticking it out through us all the way through. Appreciate that. You know, looking at this legislation, I think it's great. It provides the accountability I think that we need to view. And I think Senator Harris mentioned something about GCA, and that was basically my only question was to ask what GCA's input was on this. So looking forward to hearing their testimony, because I'd like to see this bill go through and be, you know, stronger in manner and in one way, and also provide what we all want, and that's transparency, most especially. So greatly appreciate the author of this legislation, and looking forward to the GSA comments on this moving forward. Madam Chair, would OPA chime into something like this as well? Because they do, you know, hear any rebuttal or anybody protesting. So maybe OPA as well, if we can reach out to them as well for their comments. I appreciate it. Thank you.
Thank you. I will definitely invite them to comment on the bill or testify. Senator Torres? Okay, Senator James Moylan?
Thank you, Madam Chair. Let's see. As Senator Castro had mentioned, you know, we've had how many executive orders so far? About, I think it was 7. You know, it's like 7 months into this thus far. And from our experience we've seen with these executive orders, it's all about the communications of it. And again, like Senator Castro's 399 bill and Senator Luis bill on 382. Our difficulty is sprung from the executive order and the transparency and the communication of the executive orders. And as we go further, hopefully these bills will do move forward, and eventually we'll be able to hear Senator Perez bill 386 again on procurement. But all these have come about because of our offices getting the calls and our question by the legislature, as mentioned, the checks and balances, because it's not clear, it's not transparent to us, and we need more answers. And if we can't get those answers here, this is what we must do. We had to amend the law. But in the meantime, I want to thank you, Madam Chair, for bringing these bills up and moving forward with it. But in the meantime, I hope our future executive orders are clear. And sure, we can amend the law, the public law, Chapter 19, Title 10. But for today, I just hopefully Guadalupe hears our concerns and gets word of these bills and how far it's moved forward, and that we see some changes in the meantime to help our island move forward. So I thank you, Madam Chair, and thank you for the author of this bill. Thank you.
Thank you, Senator Moylan. Senator Luis Muña.
Thank you, Madam Chair. And again, thank you to the author of this bill. Everything that we do is an opportunity for us to address concerns of the community and to bring people together to talk about it and discuss it and either support it or oppose it. And that's the democratic way, right? The process that we go through every day, what we do. I did have a question, whether it be for the author or for maybe anyone else on the panel, that if we, and maybe even the chair for procurement, maybe she would know that if we don't extend the procurement authority after 1 month, what happens, like say, for example, if a vaccine or a new therapeutic drug will become available, do we just go through the regular procurement process to buy large quantities of those drugs? And what would happen if that happens?
Yeah, I'll be happy to answer that. So there's two routes to take for emergency procurement. So there's the declaration of emergency by the governor, or there's a certificate of emergency by an agency head. So those two are the two avenues that any agency can undergo emergency procurement. So yeah, should there be a vaccine, should, let's say the emergency is considered done, that doesn't preclude any agency from going through emergency procurement by certificate of emergency. And I hope that answers your question.
Okay, yeah, it does. So it's basically then the governor could just automatically extend it then.
Yes, I believe.
If the vaccine comes out. Okay. Thank you. That was all my question. All the questions that I had, and an opportunity for us to learn a little bit more and maybe talk and see what happens with the OPA and all the other stakeholders involved. Thank you, Madam Chair.
Thank you very much, Senator Muña. Before the sponsor concludes, I would like to ask just a couple more questions. One is, first of all, maybe Congressman Nicholas, you can answer this. It's a simple question. Are there any states that have not declared on a state basis an emergency? That I know that there is we are under federal state.
To my knowledge, no. I believe every state has done an emergency declaration.
And when you discuss that the vaccine might not be widely available until 2024, how do you see the emergency ending?
Well, the
emergency
vaccine,
end before the vaccine, I guess, is the question. Yeah.
The 2024 deadline was for a global availability. Okay. And so this is for the entire world to be able to have received the vaccine in terms of capacity and manufacturing, et cetera. It'll take 2024 for it to be global. As far as national, especially because these vaccines are being developed nationally, and then the president does have special powers to mobilize the private sector for production for emergency purposes like these. We definitely can have quantities available for us to be able to receive them within the next, definitely within 3 to 6 months, assuming that the current vaccine timelines are met. And so I'm confident that, of course, the national development of the vaccine will result in the manufacturing capacity being directed specifically for national consumption. The 2024 deadline is for what is anticipated for the vaccine to have been available globally on a global basis.
All right, and I just wanted to clarify, I know this is not the Director of Public Health, but is anyone else testifying that they think we should not be in a state of emergency at this time?
I'm sorry, is the question directed towards me?
Not necessarily, no. Just want to make sure that today we have not received any testimony that we should not be in the state of emergency at this time. Is that correct? Mr. Younger, am I interpreting your testimony correctly?
I'm in my testimony, I am saying that we need more scrutiny from the administration's declarations, because right now we have heard the CDC and the World Health Organizations both say that lockdowns are counterproductive and in fact are probable vectors for causing infection spreads. And we see that here on Guam, where we have a large percentage of multi-generational households. We have a very high prevalence of chronic diseases, diabetes, cancers, which weakens the body and makes it more susceptible to the COVID infections. When you look at we're up to 67. We recorded our 67th death while we were on this conference. And when you look at those 67 deaths, 62 of them are underlying health issues aggravated by COVID, which shows that Art has one hell of a job ahead of him getting his hands wrapped around the chronic infection problem facing Guam. Because when we look, I mean, if I were to ask for a show of hands, how many people on this panel have a member of their family suffering from diabetes, cancer, or high blood pressure? Just about every hand would go up. We saw that when we did our first survey of chronic diseases back in 2015, at a time when the US rate was 9%, the public health was reporting 12%. I asked them, where did you get that 12% number? They said, oh, we got it from Department of Health. And I said, well, how did they get it? Oh, they just do a factor. So we did an actual survey of almost 900 residents, and we found that we had an over 30% of those 900 residents had diabetes. And it was the same thing for all the other chronic disease rates. So the biggest problem we're facing here, and why I think that we need to readdress this issue, the PCOR 1 has destroyed our local economy. You talked about it with the post office. Now the post office has changed their rules. Lines are moving much faster.
I just wanted to know about the current, whether we currently meet this criteria for an emergency. I appreciate that the bill would pattern. It's the same criteria that is currently available to the legislature to terminate an emergency. A declaration of a health emergency is what this bill proposes must be found to continue a health emergency. So same. And but yes, so I agree with you that the complications that these diseases pose have been very evident here in our community, and maybe give more rise to the findings that the bill proposes. But I agree with all of you. I think that yes, the bill requires just more scrutiny, more findings. I think findings are always very good They're going to help the community to come along with us to understand why we are doing something. And if the finding has to be reviewed, then it just allows for more input. As you know, we had to override a bill earlier this term that required reporting on some of those expenditures during this emergency, and that I think, you know, just like right now, we are facing an issue where the public health has declared an emergency. They recommend we are still under an emergency, that there are still compelling factors that put our community at risk. That, but, you know, we are already in September, many months into this, and we are still under discussions with the Attorney General as to whether we can enforce these executive orders, and I find that very frustrating. I think it's, you know, that it should be the lead. You know, you've got to lead us with the least restrictive means available to us as a government to control the emergency, right? And so, but yes, I guess. So, are you able to tell us the status of, Mr. Director, of you know, businesses that violate executive orders?
Madam Chair and members, with regards to that question, you actually are on point. Although maybe you didn't say, but I think it's a sentiment, is that I do agree that this question should have been raised sooner than it is today, but it has been raised. And whether the applicability of the public nuisance can result based on compliance or non-compliance, rather, with EO executive order and the public health guidance. That question still remains with the Office of the AG in terms of its proper application. And I know that I did send a follow-up inquiry yesterday, and I will do one later on, if not today, later on tonight. And so I don't have any official feedback unless it came through the email while I've been here. And so, to be fair to the AG's office, I don't know if they sent something since I've been at the public hearing this morning and through the afternoon. And so it's still in the review from what I understand at this point, Madam Chair.
All right, well, we talk a lot about the plan to move forward, and I think there's consensus that the plan is going to be, how do you operate safely? And I think, you know, the businesses are all expecting to be required to operate safely, and that might be a new reality for all of us. For example, distances or occupancy amounts and things like this. And I'm curious if we remove a state of emergency, if we can control all of those things that public health is right now trying to control. And I would like to think that we can, by some tweaking of our rules and regs or our permitting requirements. But we would like that to be very much based on science and data as to why we are making this particular restriction. And that's, I think, the biggest challenge before us right now, is to get that consistent with across the board, across the nation, you know, across, but for sure here on Guam, there's no reason we can't operate very, very clearly and consistently. And, you know, Congressman, I hate to put you on the spot, but while you're here, I hate to waste the opportunity. And I'm concerned that we are, and I'm just talking on the top of my head, so this is not scripted, but you know, we've had a challenge to get data from you know, the military side of the occurrence of you know, the COVID or the spread. And now we've got the military proposing to open schools. We here on Guam, you know, there've been a determination that schools will not be able to open. We have too many challenges in front of us to open these schools safely, or that seems to be the determination. And but you know, you know, we know that the people who, for example, the construction industry has been ongoing, especially those industries where they are, you know, working on military projects. The people are still going on and off the base. People go on and off the base for school as well, the teachers, all of it. And so I guess I don't know. How do you see this division in, it's like we're going to have two operating systems, yet for me, I don't see how the science tells us that the COVID, the spread of the virus is divided like that, or it can be managed, in systems where the community, it's not like everybody stays behind the base. They are interacting with our community. And we're actually seeing that in the videos of the businesses that, are open and accepting customers. And so we're all interacting. And I don't know. Sorry, I'm just, I guess I haven't really figured out what the resolution to that is, but do you have any thoughts on that, Congressman Nicholas?
Sure, I can provide some perspective. First of all, with respect to the number of cases that are occurring on the military bases, we do need to be mindful of the national security concern, where we don't want to be publicizing whether or not there is a weakness in our defense capabilities as a result of this pandemic. And so that is always going to be a factor that we need to be mindful of. And I understand that that's one of the reasons why, for example, they don't publicize, how many ships are out there at sea and what the infection rates are in those particular circumstances. So that's something that we need to factor. Another area that I fully understand where you're coming from in terms of how they're opening their schools and what they're moving forward with on the DODEA school side. The Indo-PACOM, the Indo-Pacific Command, has a threat assessment level that they apply throughout the entire region. And in my communications with the Admiral, he has made every effort to, as much as possible, align those conditions. The ability for the military to be able to reopen their schools, I think, is more of a circumstance that has to do with their capacity to be able to satisfactorily do so without putting the community and their mission at risk. I think that one of the things that we can look at in a proper lens would be they wouldn't be reopening their schools if they felt like they were going to be putting their mission at risk either. And the fact that they are is a testament to the fact that they've obviously adopted protocols that meet the standards, not only for the operations to resume the way they're going to here locally, but to do so in a way that wouldn't threaten the entire mission regionally. Something to be mindful of is that if they were doing something that could potentially exacerbate risks, those risks wouldn't just be contained to Guam and the bases, because they have troop interactions with current forces here on Guam throughout the entire Indo-Pacific region. And so I'm confident that if they're making the decision to reopen, they're at least on the school side, they're doing so having met a satisfactory standard to be able to do so without creating or exacerbating any existing risks, not only to the community, but to their mission. That being said, it may be an opportunity for our local government and our local Department of Education to consult with the DODEA schools here on Guam and find out, how did you guys get to a level where you're able to reopen and have kids return to school and feel safe about it, not only for the community's sake, but also for the mission, for the sake of not further endangering the mission. And perhaps that whatever guidance we can glean from that could help us have a better sense of direction with how we're going to be addressing our school circumstances and whether or not reopening under the same kind of protocols might be something worthwhile. Just for a final context, what we're doing here on Guam is not what's happening across the country. There are different jurisdictions taking different actions. Some are reopening, some are having schools reconvening, others are doing entirely distance learning. I know that we're doing, I think, 3 different options here locally with respect to education. And so, Guam at the end is going to be able to implement whatever we feel is best. But what we're doing is not exactly what's happening everywhere else either. And so we can definitely, I think, find some avenues for solutions if we look towards those examples, and to include the Terlaje example of how we can try to get our schools back open, what they've done to do so in a way that's meeting mission expectations, not putting anything into an additional risk category, and what investments they've made to be able to do that. And perhaps we can make similar investments here with the same level of confidence.
I understand the investments into schools. I guess I'm just concerned about this, vision that one part of our community can operate safely while the rest are just, going to fend for themselves and, struggle. But Director San Augustine, are you able to determine when I know that when we had a hearing recently, we were not receiving data necessarily from the military, except for the number of positive cases that was it. And the tracing that you said was being done by them. Mm-hmm. And then we had that, outbreak at the construction company. And I don't know, I just want to know, do you feel like we have this ability to make a scene in our community, and that one part can operate safely, and we are going to,
well, if I may, Madam Chair, with regards to the data, it has remained the same. We have a team that consults with the military in terms of positive cases. And the Congressman, you actually touched on a very key part, the capacity. The military has resources unlike the local government, and their affiliates, the whole Department of Defense, has very structured processes, and their structured processes actually is something that anyone who's affiliated to the military is very mindful of. So they understand these processes. This is a military comparison to a civilian community, and they're very, very distinct differences, Madam Chair. In working with JRM, they shared with us how they were very expedient in taking action for military individuals that were not compliant, to the point that they were actually released of their jobs. So they have a system that has been played well and thought well out and played through and through. So they've tested their systems, they've got their lawyers, they've got their whole gamut of support system. We had asked them about their resources, and I'll give everyone a really quick example. If you are quarantined on base, you don't leave your home. They will bring the food to your doorstep. They will let you know it's there, and then you pick it up. And this is their support system that was in place when they initially started quarantine. So like, if we put our local community on quarantine, we do not have the resources to replicate that approach. They have the manpower to do that. And those are very, very distinct differences in terms of how they operate and the resources that they have, Madam Chair.
All right, thank you very much, Mr. Director. I saw you raising your hand, Congressman Underwood. Did you want to add something to that?
Yes, I just want to add that it is the responsibility of the federal representative to bridge that gap, not to just acknowledge it. And I think that a more proactive congressional office would have been in on this issue from the time of the Teddy Roosevelt incident, and from the time when there was great dramatic attention to that. And the Dodea schools, I don't know what the percentage is of the Dodea schools that are actually local students that are eligible to go to Dodea schools, but it's a pretty high number. So it's not exactly as you have outlined it, Madam Chair. The fence is sort of an artificial barrier when it comes to public health issues, because when you think about it, the way that at one time people were behaving at Terlaje Beach while the public facilities and outside the fence were shut down, there's all these disjunctures. So there's more room for more communication. Indeed, the DOD is free to do what they want, but there should be more communication, and that communication should be facilitated by the federal representative, because it is the federal representative that can hold them to account, can make requests for information and make more explicit and open and transparent the activities that are going on inside the military facility.
Thank you for that. Yeah, it's just, you know, I wish, you know, everybody can open. I want to bring everybody along in our community. I know we have certain, you know, churches that claim they can operate safely, yet, you know, we want all of them to operate safely. And that's just, I guess that's all I'm going for, is I want us all to be able to bring each other along. And I'm going to now allow the sponsor to close, or sorry, Senator Taitano, did you have a question to add? And then the sponsor will close.
Madam Chair, may I have an opportunity to respond, please?
Oh, can I have Senator Taitano please state her question first, and then.
Yeah, it's just a comment. You know, my concern is the ways that we're intertwined with DODEA. I don't have hard statistics, but the statistics that I've heard is that maybe as much as the student population is local families, about 30%, and maybe as much of the faculty is 80% from the local community. And so, you know, the resources do give them more abilities to respond in certain ways, but you know, one of my concerns is it just creates a lot of flow back and forth. They cannot necessarily contain what 80% of their faculty are doing on the outside, where we've got one of the highest rates of cases. And so, yeah, it causes a lot of concern for me that somehow this 17% of positive case rate on our side, while 80% of their faculty are going in and 30% of their students are going in, and it's flowing back and forth. Yeah, I'd like to understand more of that because I don't think they don't want the risk for them, but we don't want the risk being exacerbated out here either. So yeah, I would like to understand that more so, because that part of it, I don't understand how that's able to be quite contained. But yeah, I just wanted to bring that up. There's a lot of that intertwinedness, to coin a term, between our communities, you know, the inside the fence and the outside the fence.
Thank you, Senator. All right, Congressman, I'll allow you a very brief remark because I've reserved the time left. We have just a few minutes remaining for Senator Castro. Thank you.
Thank you, Madam Chair. And I wanted to express my appreciation to Director San Agustin. The DODEA school system, there's a reason why they have a different outlook, and that is because they have a different way of setting standards and enforcing those standards. There's a reason why, Madam Chair, despite DODEA schools paying upwards of 30 to 40% more for their staff, that you know, there's still people who don't necessarily avail of those positions, and that is because the standard, the expectation, the consequence for not complying with the implementation procedures that they're able to adopt on a programmatic basis, the consequences are just very different. I think that there's definitely opportunities for us to perhaps see what they're doing that might be beneficial. And absolutely, if we can communicate with them and get some examples from there, then let's consider it. And just to clarify for the record, Madam Speaker, I have on numerous occasions made suggestions to this local government on certain activities that are being done, to include paying essential workers, making sure that we're providing resources to people who need rental assistance. We've absolutely been reaching out and facilitating those communications, whether or not they're being advocated for and you know, promoted by anybody on this panel is another story entirely. But you know, in order for us to be able to make sure that we're going to have a level of comfort in what the DODEA schools are doing, I think we need to understand that they're also able to hold their personnel and their students to a certain level of accountability that we are not able to necessarily adopt here. And so I'm happy that they've found a happy medium on their side to be able to reopen their schools. I'm hoping that we're going to be able to begin deploying our resources to start moving in a direction that allows us to do that safely. But I'm also not going to try and advocate for something that I think our local school system is going to have a very different set of circumstances in implementing, because they're operating on an entirely different framework from what the Dudea schools are operating under. And so
thank you, Congressman. Yes, that's exactly my point. It's not that, they have different standards. Of course, everyone has different standards, but it's that we are dealing with different people. We are dealing with different situations. We are able to control much less of the circumstances that are before us. And so it's complex, and it's very complex. And that's all. I appreciate all of you who are here. And Senator Castro, this is your bill. I'm going to allow you to close, and thank you.
Thank you, Madam Chair. First of all, I want to thank you, Chairperson Terlaje, for the privilege to have the bill addressed.
Congressman's being there. There we go.
But also to you, Chair Sabina Perez, for reaching out and agreeing to help me improve the bill as it's written. And above all, I'd like to close with just highlighting a few comments that were made on Bill 90 and this bill today. You said it yourself, Chair, that it's necessary for the government to set up the necessary mechanisms to prevent a trade-off under emergency conditions between those items that are of lesser value or higher prices. We also heard from Senator Perez herself that the idea behind both her bill and this one, and I'm hoping for Bill 386 as well, is that we want agencies to move away from emergency procurement in order that we may get the best value from whatever it is we hope to buy or procure as a community. This bill specifically intends to address emergency procurement without it having to be indefinite. That's really the crux of the bill itself. And to Senator Marsh, thank you again. I think you highlighted in Bill 90 that we all want to avoid the prolonged abuse, or at least mitigate any potential opportunity for potential abuse under emergency circumstances. So thank you for that. Again, back to the bill in closing, it makes the governor's authority to renew very explicit. Right now, as the statute reads, it's only implied under the current law. It also creates conditions in which the governor may renew consistent with the conditions necessary for original declaration and consistent with the inverse conditions necessary for the legislature to terminate the state of emergency. To Senator Muñoz, thank you for reaffirming that it restores the procurement process and regulations. You did that by asking the question that the Oversight Chair responded to succinctly, that it restores procurement processes and regulations after the original 30-day state, or in this case, the 90 days of a certificate of need has been established if Bill 90 should pass. One of my colleagues mentioned that the public sentiment about executive actions during this pandemic has been, for the most part, generally negative. And I think we heard it excessively today and in a previous hearing. That's due to the lack of clarity and the lack of regularity, if you will, the frequency in communicating these concerns. And so Leader Taitagui and Senator Moylan, thank you. I agree with you 100% that the issues of accountability during this time of extended executive authority is something that should be at the front of our minds. And Madam Chair, if I could, to the two Democrat congressional candidates, thank you for participating. I'm really humbled by that, and I appreciate your contribution, a very constructive contribution to improving the bill. Congressman San Nicolas, to your credit, I do want to highlight that, yes, you're right. I will revisit provisions of Bill 2334 relative to operational continuity plans. In the previous body, I was a co-sponsor of that piece, and so was the chair, Therese Terlaje, Senator Muñoz, Regine Bisco-Lee, Senator San Agustin, and we voted. Quite a number of us voted to pass that. Unfortunately, it was vetoed. To former Congressman Underwood, I took notes. I agree with you as well that balance needs to be had and refinement based on perhaps Director San Agustin's input, based perhaps on the phenomena that's before us as a community, or perhaps even against a particular condition of readiness that's defined and before us. Mr. Ken Leangro, thank you for your input. I couldn't agree. I'm going to close with your point, and your point was this, and forgive me if I misstated. You can always clarify, I'm sure, in the media. But I agree with you on your statement about the need to work towards protecting government resources and being mindful of the need to build up public confidence. I think everyone agrees that a united community around responsible policy to move us forward as a community in the weeks and months ahead is important to Guam families as it is to industries, and as it is to this entire government. So with that said, Madam Chair, thank you. I'm extremely humbled by the participation of this awesome panel and by your willingness to allow my bill to be heard in a month's time. Thank you. Thank you very much.
Thank you very much, Senator Castro. And I as well am humbled by the presence of our congressman, our former congressman, our Archbishop earlier today, our public health, who's been working very, very hard. And thank you for your constructive input on these bills. And we all want to see an emergency end. You know, we want to see us all operate as effectively and let people get back to their lives as soon as possible. So towards that end, yes, we are trying to flesh these things out. How far can we go with these bills to get to that end? But again, to my colleagues, Sidus Masi, for being here today and for your input. And again, thank you all very, very much. We are going to recess now until 4:30, where we will convene a roundtable to discuss pre-hospital isolation and care for COVID-19 positive individuals. The committee stands in recess. Thank you.